Welcome viewers. Today I am going to discuss the common problem faced after the ear surgery. The first problem, the patient complains of some kind of ear pain. The ear pain is expected and should be suppressed by the common painkiller prescribed by your doctor. If not, you just tell him the pain is more severe. He would see the cause and may prescribe more analgesia. Second thing is that after the surgery, the patient may say that I have some fullness or some swelling over the face, especially where the ear is operated. Well, this is expected because you have been in one particular position for a very long time. Second thing is because of the cut made behind the pinna and because of the mastoid bandage, this kind of swelling over the face is expected. So this should go away. You just keep your head and up. Once you reach home, don't lie down all the time. You can rest in reclining chair or on a sofa, and then this swelling should go away in a couple of days. The common problem patient complain of after the ear surgery is some kind of dripping sound of the liquids in the ear, some kind of tup tup sound or some chest sounds they come. Well, this sound is because of some kind of absorbable cotton, which we call in our language gel form, get by the doctor, which are made wet by the eardrops, antibiotic eardrops, and those are behind the grafted eardrum and in front of the eardrum. To the purpose of the gel form is to keep the eardrum in a particular position. So you might be hearing some sound, especially when you are swallowing your saliva. You might be hearing some sound, and this is expected and this is normal. Patient usually feel more sound during the day one and then get used to it till the seventh day visit for suture removal. And then few patients complain of increased sound or increased tinnitus after the surgery. As I always tell you that tinnitus happens because of decreased hearing, and after the surgery the hearing loss usually increases because of multiple factors including blocked by the gel form and the bandage. So in due course of time, when the hearing improves, which takes usually 6 to 8 weeks, your tinnitus should also improve. So you should not worry too much. But if you are having problem, you just discuss with your surgeon. And as I already told you, the other common problem patient says that hearing loss increases after the surgery. Well, hearing loss increases after surgery, and this should be a conductive hearing loss. But very rarely, nerve deafness also occur. So doctor would use your doctor will use tuning fork test to know whether it's a hearing loss is conductive or nerve deafness, or may sometime do bone conduction audiometry. If such thing happens, it's usually the doctor treated by steroid. Otherwise, conductive deafness is expected, and usually we don't do anything then. Sometime after the surgery, the patient may complain of giddiness or vertigo. Well, this happens because a lot of irrigations and sometimes fiddling with the ossicles happens during the surgery, and this vertigo is more during the day one, but sometimes because of pathology involving the inner ear, or there are so many factors which cause a dizziness. Just discuss with your doctor and this should settle down. And those patients who undergo surgery by in general anesthesia, since they are intubated, so these patients are likely to have a throat pain for few days or sometime mouth ulcer which gets healed up soon. So these are the common problems faced by the patient who undergo surgery. Now I should also like to discuss precautions you should take after the ear surgery. First thing is that you should avoid any kind of infection. You should not invite any kind of infection, like meeting with lot of friends after the surgery or relatives or well-wishers. Don't shake hand. Keep wearing masks. Maintain social distancing. Use sanitizer. Because any infection can destroy all the good work done by your surgeon. Second thing is that don't let your dressing get spoiled by taking bath or doing face wash or by sweating. If you are in a zone where too much of sweating is there, then try to use fan air condition or be in an open area where sweating don't take place. Third thing is diet. Anything which is cooked at home, fresh, it's good for you. Initially for 2-3 days, soft thing like uh, khichdi or soft rice or porridge or dalia will do. Medicines, you should strictly adhere to what your doctor have prescribed. If you think some medicine are not soothing to you, then you discuss it with your doctor. And whenever you sneeze, try to keep your mouth open while sneezing, because this will, otherwise the pressure will get transferred to middle ear and your eardrum may slightly give way and there might be some perforation. If you see your dressing in it have become spoiled by soakage or had come out over your eyes, then you discuss with your doctor, he would change it. Last thing, the persons who are happy or who remain busy with their hobby, their wounds get better soon. Their wound heal soon. So don't worry, be happy, keep yourself busy, involve yourself in whatever way you can be happy, and believe me, a happy mind heals faster. So be happy. I hope with this small information you would have liked, and if you have liked, please like this video and do subscribe to this channel for future updates. Thank you.